The same substances that destroy lives on the streets are sitting in hospital cabinets right now, saving thousands of people every single day. What if I told you the deadliest drugs in the world are also some of medicine's most powerful tools? If you want to see how science turns poison into medicine, hit that subscribe button because this story gets wild. Walk into any emergency room and you'll find ketamine ready to go. Doctors developed this drug in the 1960s as a safer replacement for PCP, which tells you something about how desperate they were for better options. But ketamine proved itself on the battlefields of Vietnam, where medics used it to sedate wounded soldiers fast. The drug works differently than anything else because it blocks NMDA receptors in your brain, essentially hitting the reset button on circuits tied to depression and pain. Patients stay conscious but feel zero pain, a state called dissociative anesthesia that keeps them breathing and stable when traditional anesthetics would be too risky. In 2019, the FDA approved a nasal spray version called esketamine for people whose depression won't respond to standard treatment. The speed matters here. Ketamine can knock out suicidal thoughts within 2 hours, while typical antidepressants take weeks to even start working. Hospitals use it on children and in poor regions where resources are limited because it maintains blood pressure and breathing on its own. The same drug ravers' abuse in clubs is giving hope to people who've tried everything else and found nothing that works. Paul Janssen synthesized fentanyl in 1959 and created something 50 to 100 times stronger than morphine. Surgeons measure doses in micrograms, not milligrams, because the potency is that extreme. Yet in controlled hospital settings, that power becomes precision. Cancer patients get transdermal patches that deliver steady relief for days. Operating rooms use IV fentanyl because its short half-life means patients wake up faster with fewer side effects than older opioids would cause. NASA packed it into early astronaut medical kits because the drug stays stable and works in tiny amounts. The overdose crisis everyone hears about comes from illicit fentanyl analogs made in underground labs with zero quality control. Street fentanyl kills because users have no idea what dose they're actually taking. Hospital fentanyl saves lives because anesthesiologists control every microgram with equipment that monitors vital signs in real time. The same molecule exists in both contexts, but the difference between medicine and poison comes down to knowledge, measurement, and intent. Surgeons can maintain a patient's breathing and heart rate with extraordinary accuracy using fentanyl in ways that were impossible with older pain medications. Merck patented MDMA in 1912 and then forgot about it for 60 years until therapists in the 1970s rediscovered its potential. The drug floods your brain with serotonin, dopamine, and oxytocin, creating a state of empathy and emotional openness that therapists found invaluable. Clinical trials have shown that 67% of PTSD patients no longer meet diagnostic criteria after MDMA-assisted therapy sessions. Veterans with trauma so severe that traditional therapy failed for decades report near complete recovery after just 2 or 3 guided sessions with trained therapists present. The empathogenic effect lets patients revisit traumatic memories without the emotional shutdown that normally blocks healing. In 2023, the FDA reviewed MDMA-assisted therapy as a potential prescription treatment, a massive shift for a drug most people only know from raves and music festivals. The therapeutic setting matters completely. Patients take pure pharmaceutical-grade MDMA in controlled doses, while therapists guide them through processing trauma. Nobody's dancing in a club. They're doing some of the hardest psychological work possible with a chemical tool that makes that work actually bearable for the first time in their lives. Ancient Mesoamerican cultures used magic mushrooms in spiritual healing rituals for centuries before modern medicine caught up. Researchers at Johns Hopkins and Imperial College London have led studies showing psilocybin creates a neuroplastic reset in the brain. The drug temporarily quiets the default mode network, that part of your brain responsible for depressive rumination and negative thought loops. Patients describe ego dissolution and a profound sense of interconnectedness that sounds mystical but produces measurable, lasting mood improvements. Single-dose studies show results persisting for months after just one session. The molecule structure closely resembles serotonin, which explains its broad impact on mood regulation. Oregon and parts of Canada now have legal psilocybin therapy programs where trained facilitators guide people through experiences designed for healing, not recreation. Someone who's been depressed for 20 years might take psilocybin under medical supervision and report feeling like they've been freed from a cage they didn't even know they were trapped in. The research is so promising that major institutions are racing to understand how one experience can rewire thought patterns that therapy and medication couldn't touch. Friedrich Serturner isolated morphine from opium in 1805, making it the first active ingredient ever extracted from a plant. Every painkiller since then gets measured against morphine as the gold standard. Battlefield surgeons in World War I and World War II relied on it for procedures that would have been impossible otherwise. Terminal patients in hospice care use morphine to breathe easier and rest comfortably in their final days. The fear around morphine addiction has created what doctors call morphine myths, leading to undertreated pain in people who desperately need relief. Proper palliative dosing rarely causes addiction because pain itself changes how the drug affects the body. The invention of the hypodermic syringe in the 1850s was driven largely by the need to deliver morphine effectively. Morphine derivatives like codeine inspired the entire field of synthetic analgesics that came after. Without morphine, modern surgery and pain management wouldn't exist. The drug that people associate with addiction and abuse is also the reason millions of people can undergo procedures, recover from injuries, and die with dignity instead of agony. Nitrous oxide showed up at the 19th century fairs as laughing gas before anyone realized it had medical value. Dentist Horace Wells used it in 1844 for the first dental procedure under anesthesia, launching modern pain-free dentistry. The drug acts within seconds and wears off within minutes. Perfect for minor surgeries where you need someone alert and functional quickly afterward. It provides both pain relief and anxiety reduction without the risk of stronger anesthetics. New research from Yale and the NIH is exploring low-dose nitrous for the treatment-resistant depression, with some patients showing improvement within 24 hours. British high society threw laughing gas parties in the 1800s before the medical community figured out what they had. There's no withdrawal, no lasting side effects beyond brief dizziness, just fast-acting relief that disappears as soon as you stop breathing it. Dentists use it every day on patients who would otherwise be too anxious to sit through procedures. Emergency responders carry it for trauma patients who need immediate pain control. The same gas that made Victorian aristocrats giggle at parties is now a frontline tool for both physical and mental health treatment. Benzodiazepines arrived in the 1960s as a replacement for barbiturates, which were killing people left and right. Drugs like Xanax, Valium, and Ativan enhance GABA transmission, calming overactive fear and panic circuits in the brain. In status epilepticus, where seizures won't stop on their own, benzodiazepines can be the difference between brain damage and full recovery. Alcohol withdrawal can kill you through delirium tremens, but benzodiazepines prevent that deadly spiral. ICUs use them to sedate patients on ventilators because the drugs work fast and wear off predictably. In 1985, Valium was the most prescribed drug on Earth. Emergency responders carry midazolam injections specifically for seizure first aid. The misuse risk comes from long-term daily use without medical supervision, not from acute hospital administration. Someone having a panic attack so severe they think they're dying can take a benzodiazepine and feel relief within 20 minutes. The drugs that get blamed for dependency issues are also the ones that stop seizures, prevent alcohol withdrawal deaths, and help critically ill patients tolerate life-saving ventilation. Albert Hofmann synthesized LSD in 1938 while working for a pharmaceutical company. He accidentally discovered its effects in 1943 when he absorbed some through his skin and took the world's first acid trip. Researchers in the 1950s explored LSD for treating alcoholism and existential distress in terminal cancer patients with surprisingly positive results. Bill Wilson, co-founder of Alcoholics Anonymous, privately advocated for supervised LSD use based on his own experience. The drug enhances cognitive flexibility and reduces fear around death, which explains why it helped both alcoholics and dying patients find peace. British psychiatrist Ronald Sanderson pioneered LSD-assisted psychotherapy in 1953 before cultural panic shut down most research for decades. Recent trials are investigating microdosing for creativity and mood regulation under strict medical protocols. LSD can interrupt cluster headaches, one of the most excruciating pain conditions known to medicine. The counterculture drug that governments banned in the 1960s is making a comeback in research institutions because scientists are finally allowed to study what it actually does. Patients in current trials report profound shifts in perspective that help them break free from destructive patterns nothing else could touch. Nazi Germany developed methadone during World War II when morphine supplies ran low. The long-acting opioid prevents withdrawal and craving without producing intense euphoria, which makes it perfect for addiction treatment. Communities with methadone programs see overdose deaths drop by as much as 50%. Patients can work, function normally, and stabilize their lives instead of spending every day chasing their next fix. The World Health Organization lists methadone as an essential medicine for opioid addiction treatment. Nixon's methadone programs in the 1970s significantly reduced heroin-related crime and infection rates in American cities. The common criticism that methadone just replaces one addiction with another misses the point entirely. The drug restructures dependency patterns into something controlled and manageable rather than chaotic and deadly. Someone on methadone maintenance can hold a job, maintain relationships, and avoid the infectious diseases that spread through needle sharing. The medication that started as a wartime substitute has become one of the most effective tools we have for keeping people with opioid addiction alive long enough to build a life worth living. Propofol is that milky white sedative anesthesiologists use to put you under in seconds. Michael Jackson's accidental overdose in 2009 gave propofol its dangerous reputation, but that happened because someone misused it outside a medical setting without proper monitoring. Surgeons love propofol because it works instantly, and patients wake up calmly with minimal grogginess. Emergency departments use it for airway management when someone needs intubation immediately. ICUs rely on it for sedating patients with brain injuries because it doesn't cause the complications older sedatives did. Every modern surgery from dental work to brain operations uses propofol because nothing else combines that speed, control, and clean recovery. The drug that killed a pop star is also one of the safest, most controllable anesthesia agents ever developed when used correctly. Anesthesiologists can dial your consciousness up or down with incredible precision. You go from awake to completely unconscious in the time it takes to count backward from 10, then wake up feeling like no time passed at all. Chemists first synthesized amphetamines in 1887, but World War II militaries really put them to use keeping soldiers alert during combat. Adderall combines several amphetamine salts to boost dopamine and norepinephrine activity in the brain. For people with ADHD, this increase helps maintain attention and reduces impulsivity that interferes with school, work, and relationships. The drug doesn't make you high when your brain actually needs it. It makes you feel normal and functional for the first time. Doctors also prescribe amphetamines for narcolepsy, helping regulate circadian rhythms and wakefulness in people who would otherwise fall asleep randomly throughout the day. British pilots used amphetamines during World War II bombing runs to stay focused on missions lasting hours. The college study drug reputation obscures the legitimate neurological purpose these medications serve. Someone with severe ADHD might go from failing out of school to making honor roll simply because amphetamines let their brain work the way it's supposed to. The same drug that gets abused for all-nighters and weight loss is also giving people with attention disorders the ability to function in a world that demands sustained focus. Sigmund Freud promoted cocaine as a wonder drug in the 1880s, and Carl Kohler pioneered its use in eye surgery in 1884. Hospitals still keep pharmaceutical-grade cocaine on hand as an FDA-approved topical anesthetic for ear, nose, and throat procedures. The drug restricts blood vessels at the application site, reducing bleeding during nasal surgery in ways lidocaine substitutes can't match. Surgeons use it sparingly because of cardiovascular side effects, but for certain precise operations, nothing else works as well. Cocaine hydrochloride solution sits in locked cabinets in major medical centers for very limited applications. The discovery of cocaine's anesthetic properties revolutionized surgery before safer alternatives were invented. The street drug that ruins lives is chemically identical to the medication that makes specific surgeries possible, but context changes everything. A surgeon applying pharmaceutical cocaine to your nasal passages before surgery is using the same molecule a drug dealer sells, just with completely different intentions, purity, and outcomes. Ibogaine comes from an African shrub used in Bwiti spiritual rituals in Gabon for generations. The drug rewires dopamine pathways linked to addiction essentially resetting cravings in a single intense session. People report opioid withdrawal symptoms disappearing within 24 hours of taking ibogaine. Experimental addiction clinics in Mexico, New Zealand, and Brazil use it when nothing else has worked. The United States listed as Schedule I due to cardiac risks if misused, which blocks research despite promising results. Users overcoming heroin and methamphetamine addictions after one treatment session describe the experience as a complete psychological reset. Researchers are working to isolate ibogaine's anti-addictive effects without the heart problems that make it dangerous. The traditional medicine that Western science dismissed for decades might hold answers to addiction that standard treatment can't provide. Someone who's tried rehab 5 times and relapsed every time might take ibogaine and walk away from opioids permanently. The risk is real, but for people facing certain death from their addiction, that risk calculation looks different. Medical cannabis history stretches back over 2,000 years in Chinese and Indian texts. The FDA approved CBD as a Pedialex for childhood epilepsy, finally giving legal recognition to something families had been using desperately for years. THC alleviates nausea and increases appetite during chemotherapy when patients would otherwise waste away. Multiple sclerosis and chronic inflammatory disorder patients use cannabis for pain management that doesn't carry the addiction risk of opioids. 39 states have legalized medical use based on mounting clinical evidence that politicians ignored for decades. The 1930s Marijuana Tax Act crushed early medical research and set back our understanding by generations. Children with severe epilepsy who had hundreds of seizures monthly sometimes dropped to just a handful after starting CBD treatment. Cancer patients who couldn't keep food down suddenly have an appetite again. Chronic pain sufferers reduce or eliminate opioid use by switching to cannabis. The drug that spent decades classified alongside heroin is now helping people avoid actual dangerous medications. Atropine comes from deadly nightshade, a plant that's killed people throughout history. The drug blocks parasympathetic nerve impulses, which makes it perfect for raising dangerously slow heart rates during cardiac emergencies. It's the antidote for nerve agent exposure and pesticide poisoning, which is why militaries stockpile it for chemical warfare scenarios. Every emergency medic kit and field hospital keeps atropine ready because it can reverse life-threatening poisoning in minutes. Ancient Romans used belladonna to dilate their pupils cosmetically, which is where the name Beautiful Lady comes from. Paramedics administer atropine intravenously during resuscitation when someone's heart rate has dropped to dangerous levels. The perfect example of toxicology's fundamental rule that the dose makes the poison. Extract from one of the deadliest plants in nature becomes medicine when you understand exactly how much to use and when.